Hello, I'm Julie. Are you pregnant? Are you planning on looking at what you can do to prepare for having your baby? So perhaps you've already done some hospital classes. I've actually had a few people where they've done the hospital classes and they're asking each other, do you feel prepared after that? And they're both saying no. So sometimes it's the dad who jumps on the internet and starts exploring and having a look around, well, what else is there that we can do? Sometimes it's the mum who wants to drill down further. So it's a desire to be much more prepared, to be much more confident, to have quite a bit more knowledge. So the hospital classes are great. They'll tour you around, they'll show you a few rooms. Yes, you get to talk to a few midwives, and yet you'll meet some people in the class. But after you finish the course, if you actually ask yourself, if I went into labour tomorrow, would I be ready? Strong possibility the answer is no. So what you do want to do is have some good solid information and have a person that you can turn to where you can throw your questions at them and they will give you good, solid, sensible answers back again, very practical. So the sort of thing you would want to know is how do we know that we've actually gone into labour? And what are the things that are going to occur which are normal during the last few weeks of pregnancy? And how do we know that the membranes have ruptured, that the waters have broken, and what do we do about it? What are some of the things that we need to be aware of? And beyond just ring the midwife at the hospital, which of course is a good idea, there's also, you want to understand a little bit more about it rather than just rely on what happens on the day. Also, how to avoid going overdue and what are all the medical interventions and which ones might we want to avoid and how do we do that? And how do we conduct ourselves through labour? So once we realise we've gone into labour, how can partner help you? How can they be very supportive and very connected? Rather than just, well, isn't that what the midwives do? No, the midwives are very busy and usually the normal staffing levels in Australia is 1 midwife to 3 labouring women. So they'll pop in, they'll do all the medical checks, they'll just see how you're going and do you want to ask us for anything like, do you want an extra pillow or something? And then they'll hop out again and they've got a lot of things that they have to do. So your midwives in the hospital are not your doulas during your labour. They're not your connected, emotional, tremendous amount of support. They're wonderful, that's true. But between the two of you and whoever else you bring with you, you want to be taking responsibility for feeling a lot more prepared. So that's where I step in. So when you book into the classes, you fill out a registration form. It's quite, you've got the opportunity to add a lot of information to it. I read through that, nobody else does, but I read through that very carefully and then I'm very prepared for when you come along. If you want to ring me and have a chat to me beforehand, totally fine. And anything I can help you with beforehand, I'll certainly do that. And then if you fill out your form very extensively, I pay attention to that and I can actually tweak the course to suit you. It's more like a tailored course. That's why we call it a boutique kind of course, very small groups, and I'm able to address your needs specifically. It's not like a hospital class where it's an enormous group. I know, I used to run them, and at the end of the sessions, people are much more informed, sure, but that's only compared to their starting point. And you want to be genuinely prepared for your labour. So when you go into labour, there's a certain length of time that you spend at home during what we call pre-labour and early labour. And then the midwives would prefer that you don't come straight into the hospital. It's not like Hollywood movies. They would prefer that you wait until you're in what we call active labour or good established labour at home, and then you come into the hospital. So knowing what facilities to use at home and what to have assembled and what to pack in your bag and then what to bring to the hospital and what to expect of the hospital facilities, it's vast, and I can take you through that very comfortably. My language and my wording is very gentle and very sensitive to how you're feeling. So never do I overwhelm you, never do I frighten you. These are definitely not scary classes. Am I going to show you some horrific birth videos? Not a chance. I'm a mum, I've been pregnant, I understand how it feels. So I certainly will take you through quite a lot of information. That's the transition into parenthood course. So the first half of that course, whether it's just a morning or whether it's a whole day, is devoted to pregnancy. So where you're at right now in your pregnancy and what's coming up in these next few weeks, what you need to be aware of. and talking about things specifically for you. And you get to ask me questions that are specific, that are bothering you, or something that's nagging at you, and I can help you and support you with all the solutions to that. And then we go through labour and birthing and after the birth and that first breastfeed. So that's the first session. And what I'll be giving you is this, we call it a workbook. You don't have to do much work in it. It's actually full of information. There's a few question answer pages in there just to help you work through the information. All the information that's in here is tremendously beneficial for both women and men. So partners get to actually gain a lot from going through this book. And there's quite a bit that is actually specific to partners. Page 78, for example, is helping partner understand what they need to pack and what they need to bring. Page 79 is fully information of what the woman needs to bring in for herself. So that's a very extensive workbook, and you get to keep that one. And then the second session is purely baby care and parenting. So that's another book that I've written. It's about 250 pages. And this is all newborn right through to age 5. So there's everything about feeding and sleeping, helping that baby go to sleep, how to set up the baby's bed and all safe sleeping, reducing the risk of SIDS. With breastfeeding, it's covering a lot of the basics and also helping you understand where to get extra help. So if this happens, go down that track and have a look at that website and talk to those people. And I'm signposting the way for you, not just through your pregnancy and birth, but also afterwards, those next few years. So very specifically looking at the newborn period, and that's when most people will say that they have the greatest amount of problems, is those first few weeks. So it's very important to be prepared for that, and of course for a partner to have realistic expectations of what she can manage and what she can't manage. And so what I do is take you through that in an extremely positive way. So we talk about 20 different topics in this, things that people are so glad they know. Often in the class people will say to me, do you know, I've never even heard of that. I didn't even know that was a thing that existed, even though we've got lots of nieces and nephews. Nobody's ever mentioned that to us before. The sort of thing that people do say to pregnant couples is, get your sleep now, because you'll never sleep again. And honestly, that's not true, and I can help you with those strategies as well. So how can you get more sleep, and how can you be more confident going into this rather than dreading it or the terrible anticipation? So what I always encourage everybody to do is, you can make some notes, you can write down some questions, or you can just make a list of topics if you like. Chances are we're going to cover them anyway, but if you want to be sure that you're going to get, maximum value out of it, by all means, I would love you to write down a list of topics of the things that are bothering you, what's worrying you, what's causing anxiety, what do other people complain about to you, and then I will help you. I'll step you through that on all the problem-solving techniques and guide you through the sorts of things that are going to be massively helpful. So when people have finished the course, my goodness, they are just so happy. They feel so much more confident. They're delighted. They've got the books. They have a flick through and they're like, wow, that's going to be so helpful to us later on. And they walk out of here just so glad that they've attended. So that's the Transition into Parenthood course. So what I very much recommend to you as well is having a look at doing the hypnobirthing course too. So the Transition into Parenthood course is covering all the practicalities, the things that you really need to know, whereas the hypnobirthing course is more psychological preparation. So this is helping you emotionally to prepare, psychologically to prepare for the labour and the birth. Again, if somebody said to you, if you went into labour tomorrow, would you be ready? After you've done the hypnobirthing course, you've got a far better chance of saying, yes, I actually do feel ready. Now, that's not to say leave it to the last minute and do this one day and then go into labour the next. What would be ideal is to have at least a month. 6 weeks would be good, but about a month between doing the course and when you actually go into labour To be honest with you, I have had people come through quite late, others that have been, you know, those magnificently organised people that have come through incredibly early in their pregnancy. I have had a couple of couples, not very many, where they've done the course and then they've come back and wanted to do the course again. It's just one day, that's all it is. And it's just such a wonderfully healthy mindset. So yes, we cover practical things such as the breathing and the relaxation and the visualization. So they're the three central pillars. Now you'll find if you jump online and you start asking everybody else who's done a hypnobirthing course and was it beneficial, was it helpful? Also when you go for your hospital visits or you're talking to your midwife, have you heard about hypnobirth? And ask her, do you recommend it? I mean, in a public hospital they're not allowed to recommend anything if it's outside the hospital, but certainly say to her, have you seen positive results from the hypnobirth? If you were pregnant, would you do hypnobirth? Ask them personal questions. What would you do if you were pregnant? Would you do courses? Would you prepare? Would you want education, or just wing it? Just see how you go. Throw these sort of questions at the midwife and see what they come up with. And I will be honest with you, these are the classes that the midwives will bring their partners to. Why? Because the midwives see the results of these classes. Now, many years ago, and I've been doing this for 30 years, more than 30 years, many years ago, midwives used to say to people in the antenatal visits, don't do the hospital classes, it's boring, and everybody complains about the hospital classes. Go and do community-based classes, get out of the hospital and go and do classes elsewhere. Now the Department of Health has put a stop to that because they want all the revenue in the hospital. I get that, I understand. And so that's the reason why the hospitals are A, not allowed to recommend other classes, B, they get threatened with the sack if they do. So it's very important for you to know that they're a little bit gagged with some of the things that they can say. So really these are decisions that you need to make for your benefit, for your personal benefit, and that's the reason why I'm here. So I've been doing it a long time. Yes, I have had my own 2 babies. Yes, I have a lot of insights. I've been to over 150 births over my decades of being doing these education classes. So I've pretty much well seen all sorts of things, and I'm able to bring a lot of experience, a lot of knowledge to your session and to explain things in a very compassionate, kind, empathetic way that will help you tremendously. So I look forward to meeting you.